Hey friends, it's your pal Sarge. I hope you're having a great day out there. Today we got another little mental health video, and we're going to be talking about what depression looks like in men. So this is an important one that I want people to be aware of, whether or not you're a male, because this can be true for females too, depending on the environment that you grew up in. But it's in my experience as a clinician who's been in the field for over 25 years, this is much more common in men. And so over the years, I've gotten a lot of referrals for people that have quote unquote anger management problems. And what it turns out to be is that a lot of times with our men that are supposedly have anger management problems, what it really is depression. So why is that? Well, when we're young, most men, if you're listening to this and you're a man, you're going to understand, you're going to relate to this. Most men are taught not to cry, right? So that, if you were 5 years old and you cried on the playground because you skinned your knees, you got made fun of. You got told that you were a sissy or whatever, like all these, names that people will call boys when they cry. And their dads and their moms might have told them boys don't cry and things like that, right? So what happens is we learn to turn it into something else. We turn it into anger, and that actually can be helpful in some situations. It can be more productive. But in the long run, anger can turn into rage, and anger can turn into self-hatred, and anger can turn into a lot of other things that are really destructive, right? So as an adult, we don't have to worry about what happens on the playground. We need to learn how to be okay with sadness again, right? This is the challenge for many men out there. And if you're a clinician, I am just asking you to be aware of this, that if you get a male patient referred to you for quote unquote an anger management problem, maybe you're really looking at depression, right? So you need to find out, like, when did they, as a clinician, you're going to ask questions about when was the last time they cried, right? When was the last time, what would it mean if they allowed themselves to cry? And what you're probably going to find out is that a lot of men have a hard time crying because we've buried it so deep that it's actually hard to. And we know that it would feel good to let it out. It would release some of that inner pain that we have trapped inside there, right? So it's difficult to relearn how to cry if you haven't cried in years. But it can be done, right? So it involves a little bit of trauma work. You have to do a little bit of trauma narrative, get to the source material of like where this started. And when you first, and maybe if you're an EMDR therapist, this works really well for this kind of treatment. Find out, when did they start feeling like it wasn't okay to cry, and what would happen if they allowed themselves to go back to that situation and cry, right? A lot of times that will trigger it for some of my patients. And when you see this happen with a male, especially the very masculine type men, the alpha men, I've worked with first responders, veterans, even a couple special forces guys. When you see this happen with a man, the first thing they're going to do is they're going to try to fight it back, right? Because talk about 2 or 3, 4 or 5 decades of suppressing sadness, suppressing crying, it's going to feel very unnatural to them. So you have to, as the therapist, you're going to have to encourage them to let that out, that it's been trapped in there for too long, just let it out, and it's going to be okay. And if they start crying, they're going to be okay. And eventually they will stop, and guess what? They're going to feel better. Because when we cry, we actually release in the brain something called oxytocin. Oxytocin is the same brain chemical that you get when you hug a loved one. So you're literally like giving a hug to yourself when you cry, okay? So that's something I want everybody to think about. If you're a male who struggled with this, just kind of think about the next time when you're feeling a little bit sad. If you feel like you need to cry, try to let it out. And it may be hard for you if you haven't done it in a while. If you're feeling like you're angry, just take a couple deep breaths and take a step back and say, am I really angry or am I sad? Sometimes you're sad and it's not really anger. You've just learned to turn it into anger, okay? I hope this is helpful for you all. If you're new to the channel, please consider subscribing. If you got anything of value out of this, please consider giving me a thumbs up. Keep taking care of yourself. Your mental health matters.